If you are so opposed to government-run health care, I wonder if you would vote to repeal Social Security and Medicare, which I'm sure a lot of these folks here rely on.
Well, again, we're talking on the health care issue tonight only. We're not talking about repealing Social Security. I think there's probably plenty of people in the room that would say, you know, I'm not expecting to get much in the future. But I think Social Security is a contract we've made for many years with people. I would not want to violate a contract for people in this room that have paid into it, not voluntarily, but involuntarily. All of us who have worked have paid into Social Security. We're not going to get what we thought we would, many of us, but we better get what we put in and expect that to be carried. Medicare is the same way. Medicare was brought on after Social Security. It was never envisioned to be part of Social Security, but it's been added into the whole process of government controlling key areas of people's lives, as opposed to saying, you know something, we want to make the playing field level for jobs and economy and employment. We want everybody who's able to work, and that's something I think we ought to get as a mantra. If you're able, you ought to be working. And some would say, you can't get a job in Michigan. Well, as far as I know, there are 49 other states. And I think at this point in time, there are a lot of people who are saying to me, as I do door-to-door and phone call, now wait a second, it's gotten to a point right now where it ain't easy, but if you can work, you ought to work.
I work 50 hours a week, and I don't have any health care.
Ma'am, you can get in the line if you'd like to and respond that way. But bottom line is, let's make the jobs opportune for each people to have. Ultimately, if the economy grows, you will have the ability to buy your own health care coverage, or business will provide it for you. Government has shown in many cases, Social Security, Medicare being two of those, that it's incapable of dealing with a system without huge costs, fraud, and ultimately far less than what you thought you would get. Yes.